Okay, we're going to do a practice on IM injections using vials, and also we'll practice with ampules. When you obtain your syringe, generally now you're going to have some type of a safety needle. Sometimes your syringe will come with a needle attached. Other times it'll come with just the syringe in a package alone, and then you have to obtain your own needle. In the case that it comes with your syringe attached, go ahead and open it, pull your paper back out of the way, hold your needle in your package, pull your syringe out so that you don't contaminate the tip of your syringe, and then leaving your needle in here will keep your needle sterile. You generally want to avoid using a sharp anytime you can, so as you're filling your syringe, working at the med cart, then you want to work with some type of a blunt and save your sharp for the bedside. There's different products on the market. This little guy is one. It is all plastic. When you're opening it up, make sure that you just hold your edges of your paper down out of the way. And then, anyway, here it is. It is just a sharp piece of plastic. Again, one method for avoiding using a sharp at the nurse's station. Here is a blunt type needle. Whoops, I left that on there. And again, hold your paper back out of the way, attach it, and pull it off. It's like an 18 gauge, so that you can easily use it for filling. It has kind of a blunt tip on it so that you would avoid, hopefully avoid sticking yourself. And certainly for real, I would not touch that, but I just wanted to show you that it's definitely not a real sharp point. Anyway, so I've got this ready. I'm going to withdraw from a vial. Always remember, when you're holding a vial, you want to hold it by the neck so that, you know, when I'm withdrawing, I want to hold it by the neck. Then it doesn't matter what size I have. I can easily manage a single dose vial to a multi-dose vial, and I'm comfortable with it. I'm going to, let's say that I'm going to draw up 1 milliliter of medication, and what I want to do when I need a milliliter, I need to add an extra tenth to it, because ultimately I'm going to be changing to a needle with a dry hub. And if I don't draw an extra tenth, I'm going to be a tenth short when I inject into my patient. So I want to pull it back an extra tenth. I am going to cleanse the top of my vial, allow it to air dry, access my vial. You want to go right into the center, and then when you turn it upside down, you want to be able to see the fluid level. You want to make sure that your needle is well below the fluid level so that you're not drawing air. I'm going to turn it back over, inject, and withdraw my fluid. You will get air when you withdraw, because you had air in this hub, and so you're at least going to have that tenth of air. You want to go ahead and inject it back up into your vial, and then pull again, so that basically you want to get rid of all of your air while you're here with your vial. Click on it. You should be able to get rid of any little bubbles that are down around the rubber tip of the syringe. Once you get them to go up, inject them up into the vial. We do want to avoid touching the piston of the syringe here, and the reason being is you want to, if you're touching it, if I touch it, I pull way down, and then I touch it, and then I inject, I'm going to be contaminating my fluid area, and so then I've contaminated everything. So while you're drawing up your med, you want to avoid touching it. I'll push it back up here and get my dose exactly. Then I'm ready to change my needle. We always want to avoid recapping in any instance possible, but some instances you will need to. You want to use this scoop and swoop method, so it's basically a one-handed deal. Then I'm going to remove this, drop this in the sharps, and then reapply my sharp needle. Screw it on tightly so that it's not going to leak when you go to inject your medication at the patient's bedside. Alright, so I have no air in my syringe, but I have fluid, I have air in my hub, and what I need to do is, with the bevel down, I want to inject that last milliliter, and I want my hub to be filled with fluid all the way out to the tip of my needle. So I'm holding it horizontally, and I'll just go ahead, once I get out there, click it to tap it and make it drop off, because you don't want it to be coming back down the length of your needle, because if you have a very irritating medication, then you're going to have you're going to have your needle contaminated with that, and it's going to be a more painful injection. So then we are ready to recap, and we want to label appropriately with the medication, the dosage, and the patient name, and then we're ready to take it to the bedside. Alright, I'm not going to inject fluid into this pad, so I'm going to put it back in here. Alright, and replace it with air. Okay, so I come to my patient bedside. I am going to, I'll show you the sites here in a few minutes, but right now for injection technique, what I'm going to do is cleanse my site in a circular motion. I'm going to go from inner to outer, and then I'm going to allow that to air dry. Okay? Take your swab, stick it between your two little fingers. You're pulling your skin taunt, and we'll say this is totally dry now. I have my skin taunt. I am going to hold my syringe like a dart. Okay, I'm never going to put my finger on the plunger as I inject, because then, like say, if I came down here and someone's skin was kind of tough, I had a difficult time pushing it through, I might start injecting the medication before I got through the skin. You never put your finger up there. Hold it like a dart, get a little wrist action in there, and inject completely, stabilize, aspirate. You'll aspirate a tenth or two, and you'll feel resistance. You're looking down here for blood to come up in there. If you did, certainly you'd have to remove it, take it out, start all over. The muscle is vascular, and so there is a risk of going into a vessel. So once I've aspirated, then I'm going to inject at kind of a slow rate. Done. Okay, wait a second. Allow the medication to absorb into the tissue for a second there, and cover. Alright. I always suggest that in order to help you remember the steps, if you say, you're doing a darting action, inject, stabilize, aspirate, inject.